Okay, gentlemen, if you want to go ahead, it looks like we kind of
Go ahead and start the webinar. And I'm Greg Skipper, and I'm the medical director for the Center for Professional Recovery in Malibu, California. And we've been doing webinars trying to find interesting topics that are of interest to people that are interested in professional health and substance use issues. So I think maybe it's best if everybody mutes unless you want to speak. And we'll go ahead and start. So Matt, you want to introduce yourself?
Sure. I am Matt Goldenberg. I am an addiction psychiatrist, and I work with Greg, with Dr. Skipper, at the Center for Professional Recovery.
And so we'll begin with a case. Matt.
All right. So I'm going to start us off so we're all in the same kind of headspace about what we're talking about, and then we're going to go into the science and all the other issues that related to it. So let's think about a 32-year-old third-year orthopedic surgery resident. He's currently in monitoring by a state physician health program. So for those of you who don't know, PHP is a physician health program. He's 2 years post-treatment for an opioid dependency. In his second year of monitoring, he has a positive dried blood spot PEth, and it measures at 34 nanograms per milliliter on a routine testing. So this is a not for cause event. It was just routine testing and it comes back low positive. It's important to note that his random urine tests have averaged about 3 per month for all of these, the 2 years under monitoring, and all of them have been negative, including alcohol and its metabolites, including ETG. And so he is referred. This is a typical case we might see in our evaluation program to figure out what's going on here. So as in this case, and of course the names have been changed to protect the innocent, for example, he's gotten very positive reviews at work. He's thought of as a very hardworking, physician. He's working long hours, doing great. There was only one complaint from the monitoring program. He had one missed urine drug screen in the past year. He had said he got too busy and forgot, and then obviously the subsequent tests were all negative after that. He missed 3 group sessions in the past year for group therapy. His monitor and therapy group leader have said that he is doing really well, really solid in recovery, and all of the drug testing that's done during our evaluation, the ETG from urine, another blood PEth, a hair ETG, and for those who don't know, you can test for metabolites of and Greg will go into that in a bit, of alcohol in hair. All of them are negative upon coming into our evaluation. We found that he's active in AA, he's going 3 times a week, and based on his statement of his recovery, he's working with a sponsor who we speak with. They're checking in at least 3 times a week, very, no concerns, very active in AA. Sharing.
How are you?
Good. How are you doing?
This is a good reminder if you're not on mute.
Available?
Yes, my little I'm in car line.
Who's ever talking to Laura, you're not on mute. Please put yourself on mute.
Joining me soon, but I'm good if this is good.
Can everybody mute
That's
themselves?
perfect. I hope your little fella's doing well.
Oh, he's great.
I think this may be Rebecca. Calling Rebecca.
I think. But
Russ, can you mute everybody except us?
I have every reason to be.
Okay, I have unmuted. Greg, you'll need to unmute yourself too. It's a good reminder that even in 2021, it's important to check to make sure you are muted. Hopefully everyone can still hear. His girlfriend claims he's too busy, overall her complaint, but that she has no concerns about his drinking. And we speak with the residency director and says there's absolutely no way he could be drinking. He's here all the time. Great resident. So during our evaluation, he's participating in groups. His story is consistent. He seems to be in solid recovery. We actually do a polygraph. Not all programs do that. We use it as a truth inducer. So it's a good way if somebody has a concern like this, that we might be able to induce truth by offering a polygraph. He was more than willing to do it, and it came back negative. And the question obviously been, had you knowingly drank alcohol in the last month or whenever that period was? And his came back negative, which is good. It confirms, at least from the polygraph standpoint, that it's supportive of the story. And what our conclusion is that there was no convincing evidence of a relapse. We said he was okay to return to work with heightened supervision and continued careful monitoring. And so I think what's important is that this case highlights where you may have a positive PEth test and you have to determine what do you do with it? What's the clinical significance of this positive test? And we're going to test, and we're going to spend the hour talking about that. So just as a follow-up, 4 years have passed. We check in annually. He's done really well. He's now out of monitoring for about 2 years, completed residency, solid in his practice. The girlfriend who said he was too busy and him got married, and they have a 1-year-old child. And he continues to deny that he drank at all during residency, and we still have no idea why he had a positive PEth test. So this is a great example of a really difficult test or a very difficult case where is it possible that we had a false positive blood PEth? And there's strong opinions on both sides, which Greg's going to go into about, is it possible? Is PEth a perfect test or is it not? So just as another way to look at this, not all of the cases are the same as this one was, but we will use PEth. Some examples of use would be to clarify a positive ETG or ETS. So many of you may be familiar with that. Maybe there's a positive urine test that had low positive results. So you could use a PEth, a blood PEth, to confirm if there was drinking or not. After vacations, after holidays, as many of you know, the detection window is longer for PEth, and we'll go into that, than it is for, say, a urine ETG. So if you're trying to see if somebody drank over their 7 days in Greece, you might be able to get a longer detection window using a PEth, and that's why the post-holiday, post-vacations are useful. You can get random PEths, as was in this case. Periodic routines, you could also include that for somebody who's in recovery, maybe once a month do a PEth or quarterly. And then obviously for cause, if, as we will do in our evaluations, if there's a reason to check somebody's story of their sobriety, you could order a PEth to help you determine that. So how do you use a positive PEth? And that's what we're going to be talking about today. So what we feel is that a positive PEth is a strong indicator of recent beverage, alcoholic beverage consumption. It can encourage a patient to be honest, as mentioned before, just like a polygraph, mentioning to somebody, all right, that's, we heard your story, but we're going to order a PEth to confirm. Sometimes when people hear the detection window, the sensitivity and specificity of the testing, they may then be encouraged to, be more honest potentially. It can encourage us to send somebody for a more thorough evaluation, as was the case in the case I just presented. So somebody had a PEth during monitoring and it led to a higher level of evaluation. It can, as we recommended in our follow-up, a positive PEth might increase the recommendation for higher levels of monitoring, maybe more frequent follow-up and testing. And then in the future, with a positive PEth, you may need to more closely follow the patient or study the patient. So these are different situations where if you have a positive PEth, you could consider how you would want to clinically change things.
So thanks, Matt, and feel free to chime in if you have comments
Okay.
any further. So let's see. So this is a study that I published with Frieder Verst, who's been my research partner in Europe. And we, when I was at the Alabama Physician Health Program, we had, over a period of time, we had 18 positive urine ETG tests. And at that time, 8 people denied drinking. And we reported here that the PEth test helped because it helped resolve half of those. So out of the 8 who denied drinking, the PEth was positive, and 3 of those people immediately admitted drinking, and then 1 later. We still had 4 positive ETGs that we weren't sure. They were all low positive, so they were probably incidental exposure. But the point of this article is that PEth testing can help when you have a positive ETG or ETS when the person denies drinking, especially if it's a low positive. In that article, I stated, because blood PEth is only positive following significant alcohol use, far more significant than can be normally attained from extraneous exposure to alcohol, it is more specific for drinking. So we still believe that. And so one of the main topics we're going to touch on here in the title of this webinar is about the specificity. So is there ever a false positive PEth test that, could somebody not be drinking at all and have a positive PEth? And that this suggests maybe not, but over time we have been concerned because we've had a number of cases like the one Matt presented, where it really did appear to be a false positive. So I want to just take an aside here and talk about ETG testing. So back in 2001, this was a Wall Street Journal article about ETG testing that I helped get going, and it highlights a case, Nancy Clark, who lost her nursing license because of a positive ETG. And this was early in ETG testing. I think it was 2006. So let's look at the history. I want to bring this up for a reason, you'll see. In 2001, I recognized, and along with Dr. Verst and others, that we needed a better marker to document abstinence because urine alcohol was too short-lived, not adequate to really document abstinence. ETG seemed perfect initially. We did an initial study that showed that it identified the drinkers 100% and 100% of the non-drinkers were negative. This was a fairly small number of patients, I think 36 patients, but we were using a low cutoff for ETG and it looked perfect. We were excited. We had found something because these were people that went home over a weekend, and then on Monday, the test predicted exactly who drank over the weekend. In 2004 and even before, concerns started to arise about false positive ETG tests. So could people not be drinking and have a positive ETG in their urine? Of course, now we know that that's definitely true, but then we weren't totally sure. People were being sanctioned, like Nancy in the previous article, and some people vigorously denied drinking alcohol. In 2006, we proved through a couple studies that even hand sanitizer, which we thought there was no way that could cause a positive ETG, but we found that it could, mainly from the breathing of the vapor. And then a number of other studies started coming in showing other sources of extraneous alcohol could cause positive urine ETG. So in 2012, I was working with SAMHSA in Washington, and we issued an advisory warning about the fact that extraneous alcohol could cause, low positive ETG tests. But over the first 10 years or so of ETG testing, laboratories in the United States started running the test because they wanted to provide it for their customers. And they were pretty much all saying that a positive ETG was proof of drinking, 100%. What happened there? Let's see. Sorry. And some called it an 80-hour alcohol test, which was clearly not accurate because it depends on how much you drink, how long the test can stay positive. The reason I bring this up is that labs can, and maybe no surprise to people, can oversell new tests, especially before we really clearly know all the parameters. And that's what happened here. A number of people were sanctioned. And in 2010, there was a pretty large class action lawsuit against labs, TPAs, and monitoring programs that shook this up and helped people realize we have to be careful with urine ETG. It's not always proof of drinking. And now we know that. So the question is blood PEth 100% specific for drinking alcohol? In other words, are there ever false positive blood PEth tests? And as part of that, we'll try to answer that question. And here I asked a couple of associated questions. Can any lab test be 100% specific? Do we ever have, you might say, a perfect test? Has there ever been a proven false positive blood PEth test? Has there been adequate studies to determine if there are false positive PEth tests? So we're going to try to answer these questions. So there have been very few studies that looked at extraneous exposure and could it cause a positive PEth. So this is from our friends at the University of Florida, published earlier this year, where they actually took 16 subjects. And I'm going to come back to this because that's a small number of subjects when you're really looking to see if a test could have a false positive. But anyway, they had 16 subjects. They agreed not to drink for 5 days and during the study period of 12 days. During the study period from days 0 to 12, they had them use 21% mouthwash 4 times a day. And they did urine ETGs daily and blood PEths on days 0, 6, and 12. So they're trying to see if using a high alcohol content mouthwash could cause a positive PEth test. So looking for actually a false positive when you're talking about a positive, meaning actual alcohol consumption. So here's the design, it's day 1 through 12, and, ETGs every day. Now, all the ETG tests were negative in these patients. So even though they were using mouthwash 4 times a day, their ETGs in urine were negative. And they did, PEths, as I mentioned, 0, 6, and 12. Here's the patients. So there's 16 patients, men and women, and some were positive at day 0, which could mean that they drank before that 5-day absence period. It would likely mean that. Some, and the ones that were positive on day 1, these two, 13 and 16, went down. Well, the one that caused concern that it could be a false positive was subject number 6, because they had a very low positive PEth on day 0 and day 6, and then it went up on day 12. Now, none of these patients had a PEth over 20, and that's the kind of the cutoff that most of us use for drinking. But still, this was a concern. Why did that go up, and could it have gone up higher with more extraneous exposure? Well, they came up with 6 reasons that subject number 6 may have had an increased PEth associated with the mouthwash. So one was analytic error. In other words, could the test be wrong? Well, they did another blood on day 13, and it showed a positive PEth slightly higher at 13. So that kind of proved that it wasn't an analytic error, that truly the PEth had gone up. They said, well, maybe the person drank secretly, could have drank and, gotten around the urine ETGs, or maybe it was a non-beverage alcohol. Now, as we're going to see, that's often what this first number 2 here is, that people were secretly drinking. It's what's been said when other cases have come up like this in other studies. Could the person have substituted the specimen? Well, that's unlikely. I mean, why would a person in a study substitute a specimen? Who knows? Could be. But number 5 here is the one I want to focus on in a minute, is could this patient, this subject, have had a higher PEth from mouthwash because their PLD, phospholipase D, which is the enzyme that makes PEth, could that person have had a higher PLD activity? That would enable more efficient PEth production from ethanol contained in mouthwash. And then finally, there is a variation in PEth half-life from like 4 days to 12 days. So there's quite a spread between individuals of how long PEth can last. And when you have a longer half-life, the PEth can build up more from a smaller amount of alcohol. So their conclusion of this article was that none of these patients had a PEth over 20. So they felt that the cutoff of 20 separated those who hadn't drank, which none of these people supposedly had drank, from people that did drink. So they were confident that the cutoff of 20 did likely separate, those 2 groups, people that have not drank and people that did drink, by studying these people that supposedly had not drank. But they said it highlights the potential heterogeneity regarding individual differences in PEth response. So they here acknowledged that some people make more PEth than other people. And, that's not surprising. We see that with other markers. So what do we think about blood PEth tests? Well, as Matt said, we think it's an excellent tool used in combination with other markers for documenting alcohol abstinence and or early detection of relapse. So we think it's an effective tool. It's formed when phospholipase D catalyzes a reaction between ethanol and cell membrane lipoproteins. Now, the phospholipase D normally catalyzes a reaction between those lipids and water, resulting in phosphatidic acid, which has a function in cells. Anyway, at 20 nanograms per mil cutoff, PEth is said to become positive after about 7 standard drinks or 100 grams of ethanol over a week, and remains positive for up to 3 to 4 weeks, or maybe even more in people with long half-life, who have long half-lives for PEth. So there's a lot of variability in here. Now, I was surprised when I looked it up, and I would encourage you guys to, if you're interested in this, to look up phospholipase D. It's been studied extensively because, a lot of people want to know how cells work, and the phospholipase D and its byproduct phosphatidic acid have a lot going on that they do in cells. So it's been studied extensively. And as I said, that's the normal product, the phosphatidic acid of phospholipase D. But when alcohol's around, it binds alcohol to these lipids. And in the biochemical world, it's known that PLD activity is highly regulated. So it varies depending on hormones, neurotransmitters, certain lipids, small molecules. I keep doing that. What's going on? Okay. Small molecules. And we also know that there's more than one form of phospholipase D. There's at least 2 major isoforms, and those are encoded by different genes. So some people have more phospholipase D, and some people can have higher activity of phospholipase D, depending on things like hormones and neurotransmitters and lipids and stuff like that. So PLD activity, this enzyme that makes PEth, can vary greatly between individuals because of genes and interaction with other things. In fact, so biochemists, in the articles I've read, they use a method to test for PLD activity. And what they do is they add a given amount of ethanol to a specimen and measure how much PEth is produced. And that gives them an idea of how active the PLD is, how much PLD there is. So what that means is that PLD activity determines how much PEth is produced. So I think we should be interested in this idea of PLT activity, and it can vary greatly between individuals because of genes and those other factors I mentioned. So these are the factors that were mentioned in the biochemical articles that I read, that I went through. And, so how often could this happen? Who knows? But what I want to mention is that the relatively small number of patients that have been studied may not be enough to pick up on these genetic and associated influences that could greatly change the amount of PEth that's formed between individuals. So one of the conclusions we're going to have is that the number of people studied has not been large enough, and we need to study people on meds, people that are older, younger, people that have different illnesses, things like that, and that has not been done. So we don't know, who might have these factors that could change their PEth level. What did I do? Man, let's see, there it is. Keep messing up there. So these questions I asked earlier, is blood PEth 100% specific for drinking? So if you have a positive PEth, is that proof of drinking alcohol? Or another way to say it is, are there false positive PEth tests? And the sub-questions, can any lab test be said to be 100% specific? And my belief is, and you can have your own belief, but I don't think any test is perfect. In my experience over the years, every test that I've used over time has had, even if it's rare, but there have been issues. Has there ever been a proven false positive blood PEth test? And the answer is no. And part of the reason is very few patients have been studied that claim they have a false positive PEth test. So when we get somebody who has a positive PEth, like the case that Matt presented, and they say they didn't drink, we need to figure out ways to study that person, their biochemistry, their phospholipase D activity, and other associated chemicals that I'll mention briefly, to see if there are reasons that that person has a more high likelihood of a false positive PEth. And there are just not enough studies looking at patients and the possibility of false positives. And that's this question: has there been an adequate studies to determine if there can be false positives? And my belief is the answer is no. That really the only one I could find was the one done at University of Florida, and that was just using 4 times a day mouthwash. And if those 4 times a day mouthwash people had been using hand sanitizing gel with 60% ethanol, if they had had an over-the-counter med with alcohol in it, or et cetera, they could add up to cause a false positive PEth. So still, we believe that blood PEth is very useful. Many patients do admit relapse and can receive earlier help because of the PEth test. Some are referred for further evaluation, and that can result in information that leads to confirmation of relapse. Some may just, if they're looking really good and they have a positive PEth and you're not sure what's causing it, it can increase their monitoring. Other signs of relapse can emerge, all these things that suggest the person isn't doing well. But one thing we know is that if somebody in recovery is relapsing, it's not the only chance we get. That they're usually going to continue to have trouble. And if we observe closely, we will see very likely other evidence and be able to diagnose the relapse. Now, this worries people because if somebody's relapsing, then they're a danger to the public, depending on their profession, of course. But, it is one way to try to resolve this, is continue to observe closely. So, in conclusion, new tests can be useful even before adequate research is performed to determine specificity. So, PEth has a use even though we don't totally know the ins and outs of can there be false positives. And I think my belief is there can be, because of the number of patients we've seen over the years, like the one Matt presented, where it just looked like there was a false positive and we didn't understand why. And I've talked to my colleagues around the country. A lot of people have seen an occasional positive PEth in someone that really did not seem to be in relapse. But this is important because in some places, a positive PEth is interpreted as meaning drinking, and people are fired from their jobs, lose their license, all kinds of consequences. So this is an important subject. So it's unlikely that any test, in our conclusion here, is 100% accurate. And then low positive PEth tests should not be used alone as proof of intentional alcoholic beverage consumption. So what we're defining as low positive is, right currently anyway, is under 100. Individuals who convincingly claim they have not been drinking following a positive blood PEth should probably be studied more carefully. And there's different ways we could do that. We should do that. And so I won't get into that right now. So anyway, we wanted to open this up to questions. By the way, if you ever want to ask me a question, there's my contact info, and I'm sure Matt wouldn't mind you contacting him. But If you have a question, you can unmute or raise your hand, I think, maybe the best way. You can raise your hand using Zoom. You guys know how to do that probably. It's in
Under reactions now.
okay, under reactions. So they moved it from participants to under reactions. So we encourage you to ask questions. You know, this is a controversial subject.
Greg, we have
Go ahead.
a few questions that were in the chat.
Oh, good.
One from Letitia, one from A. Miller, one from Paula, David Smith, and John Novick. All pose questions in the chat if they want to start.
Great. Let's see. Should I look at the chat then and read that? Let's see. Okay. Paula asked, does anyone have a list of foods that contain alcohol and can cause positive ETG? Paula, if you send me an email, I'll send you a list.
Okay. Thanks, Greg.
Yeah.
And that extra testing, if there's a positive PEth but less than 100 nanograms, would that be hair?
No, that's blood.
No. But I mean, if you want to do further testing of a positive PEth, that you suspect that.
The further testing of the person?
Further testing.
It could be hair ETG, although I'm not too confident that that's going to distinguish things. But it more likely would be doing an exposure study. So let's say we have an airline pilot who tests positive, low positive for PEth, and he says, no way I drank. And there's a lot of corroborating evidence that he didn't drink. You know, what would be nice, and I've wanted to do this, is put him in the hospital, make sure there's no alcohol around, and expose him to minor sources of extraneous exposure like hand gel, mouthwash, and see if we get a positive PEth in that individual. That's what we did when we studied ETG to find out that hand gel can cause a positive. Now, another possibility is measuring their phospholipase D activity. And right now, I don't know a lab that does that, but we could find one, you know, because that is something that can be done. Let's see. Okay, let's see. Okay, can a medical issue cause repeated positive PEth tests? Well, I'm not confident enough to answer that, but I'm going to say with common sense, if you can have one false positive PEth test from a medical condition, you could probably have more than one. So again, we don't know the parameters that could cause a false positive PEth. I think they exist because I've seen patients where I'm pretty sure it happened. And now that I read more about PLD, I think there's reason to be concerned that it can happen. So maybe the answer is yes. Another question, could these results be positive because of genetics, chemical makeup, and the use of other medications after the use of non-beverage source of ethanol? The answer, I think so. That's my belief, is that people can have activation of their enzyme system because of genetics or these other factors. And then when they're exposed to a small amount of ethanol, it could produce more PEth and give us what would be, in a way, a false positive. If we're going to say a positive test means drinking, then if that positive test didn't mean drinking, that's a type of false positive, even though alcohol was present. Okay, Monica asks, when we talk about variability of PEth values dependent on PLD activity, let's say in a situation where someone is being assessed for the first time, what type of differences are we talking about, assuming there has been abstinence from alcohol after a certain point? In other words, can PEth remain prolonged for twice as long? I believe so. I believe that some people have a much longer half-life on PEth, and so they can have PEth positive for longer.
Can I ask a follow-up question to that?
Yeah,
Sorry.
Go ahead.
So,
Sure.
and I guess this is teaching me a lot of new information, because I think from where I recall, on the labs, anything over a 20 or a 30, was considered a positive PEth result. And so with this information, this changes, I think, the way I conceptualize it. But when it comes to assessing someone for a mild or even moderate use disorder, I'm trying to understand how the PEth can be the most valuable then if there is some error for, like perhaps some variability. And can we test someone's PLD activity? Is that something that is it an enzyme test that's accessible, or is that getting into more esoteric stuff? I mean,
it's not available at this point, but hopefully I think we need to be looking at that because of this research I've done. I think that could explain why there's such a variability. But having said
actually,
that, go ahead.
Actually, Greg, thank you for that extraordinary presentation. Hey, pleasure seeing you. And well, basically, we believe that PEth tests above 20, as you said, Monica, indicate ethanol exposure. And of course, you're right, PLD activity influences the PEth levels, but above 20, it is likely to be ethanol exposure. And like we had with ethyl glucuronide, of course, intensified testing should be indicated. And it should not be a clinical decision be made based on a laboratory test. That's what you said earlier, and we said earlier in our common paper. So the clinical decision is still the most important, but we can't deny if there is a level above 20 that there was ethanol exposure.
This is Dr. Verst from, where are you today? Are you in Germany or Switzerland?
Actually, now I'm in Germany, yeah. Okay,
so Dr. Verst is a world-renowned expert in alcohol markers who I had the pleasure to work with some years ago. And thank you for joining us and for
pleasure.
So
interesting
webinar.
So it sounds like a repeat test might be the most, in addition to, of course, maybe ETG, and breathalyzer, but maybe a repeat test to make sure it's downward trending would be the, what to do if it comes to assessing acute impairment. So we're not talking about.
Let me try to answer your former question real quick. There have been studies that show that roughly the level of PEth does correlate with the amount of drinking. So, in one of Frieder's papers, it showed, levels over, I think it was 200 or something in that range, were more significant than, under 200 down to 20 was like moderate drinking when you look at the different, forget which test you use. The audit C scores were correlated, but anyway, so roughly, but what I'm talking about here is the outlier. In other words, what we're seeing, guys, and I bet some of you have seen it, is an occasional patient out of like maybe hundreds of patients or hundreds of PEth tests. We see an occasional patient where they have a low positive PEth, and it does not look like they were drinking beverage alcohol. So my hypothesis, and it's not proven, is that this could be due to their PLD activity. And it needs to be studied at least, because could we have an occasional person, and I'd be interested in your thought on this, Frieder, is, one out of 100, 1 out of 500 people that even with low, maybe the hand gel and the mouthwash or something like that, could have a PEth over 20. You think it's possible?
Actually, I talked this afternoon with Wolfgang Weinmann in Bern, Switzerland. And, we three already had some papers on that. And he said, actually, it's unlikely. And of course, you're right, Greg, that phospholipase D activity influences PEth levels. And there is also some rumor that phosphatidylcholine influences PEth level. And
I saw that paper.
That all might be true. However, it is unlikely that it exceeds 20 as a cutoff level.
Well, but saying unlikely does not mean definitely ever.
Right.
And so when we're dealing with a rare patient,
yeah. I completely agree on that. And you said very wisely some years ago in a paper, I guess we both published, that a clinical decision is needed and not a laboratory test makes a decision.
Yeah,
so maybe improved testing might be necessary, but a clinical decision never should be made on a laboratory test alone. Yeah.
So the problem there, Frieder, is everybody wants a perfect test, and I understand that. The FAA want to know, if a pilot that had a DUI a year ago has a positive PEth, they want to, and I've been on arbitrations on this, they believe, and some of the labs are saying, over 20 PEth means drinking alcohol, period. It's proof positive. And I guess what I'm feeling after seeing a number of these patients is rarely that may not be the case. And so you do have to look at the clinical. And that makes everybody nervous because the clinical is not on paper. It's not proof like a positive test is. Anyway, let me keep looking at questions here. And if anybody else wants to speak up, just unmute and make a comment while I'm looking.
Thank you, guys.
So here's somebody's question. So what you're saying is that defense attorneys have an argument for now. So yeah, that's a concern. Am I giving, by doing this webinar, everybody the right to say I didn't drink after a positive PEth test? And that's not my goal. My goal here is to get to the truth. Is it possible that rarely a positive PEth could not be drinking alcoholic beverage? And I believe the answer is yes, both based on my clinical experience of seeing a lot of patients that fall in that category and this new data I've looked at on where PLD activity can vary a lot. I just have not, obviously Frieder knows about that, but a lot of people have not thought about PLD activity and how it might affect those. Is there a half-life that is not consistent with abstinence? So that's a good question. How do you determine half-life of PEth? Because the person may be drinking while you're checking serial PEths. That's a tough one. Again, when we do studies, we have to figure out some way to know if somebody's drinking or not, because it can affect the data. So, I don't know if you have a comment on this, Frieder, but it's said that PEth can vary in half-life from 4 to 12 days. And why, I don't know.
So if you had someone who you were graphing their results and it looked like their half-life was a month, our assumption is they're drinking in between PEth tests, and the graph really should be looking like this. So we're seeing incredibly slow decay.
So that's the question. Any study we do where we're trying to determine how people test off alcohol, it's always a question of, are they really off alcohol? That is a difficult thing. We had that concern when we first tested somebody for hand gel and ETG. We put her in the hospital, had her searched, and she showed up positive for ETG, and we didn't believe it. And we thought somehow she must have got a hold of, an airline bottle of vodka or something. But we did further testing and found that indeed, hand gel can cause a positive urine ETG. So the question is, how do we know this? And I think it's born out of ongoing research, like Dr. Verst is doing, and we should be looking for this kind of data instead of just saying, a positive PEth means for sure drinking and ruin people's careers and their lives. Yeah, I think somebody asked, is ethanol exposure different than ethanol consumption? It depends on how you define it, but yeah, there could be a difference. What about the possibility of autobrewery syndrome or even a subclinical ABS if someone is colonized with appropriate offending yeast or bacteria? That's a really good one. Yeah, somebody, what's her name? Theroff, one of your colleagues, Frieder. She did a study where she gave people sugar and brewer's yeast and got pretty high ETG levels. We don't have a lot of data on that. It is possible, I guess. I don't know. What do you think, Frieder?
Yeah. So sorry, no knowledge on that further than you reported.
Okay. Have you ever had a positive ETG but negative PEth? Yeah, because it takes more alcohol to cause a positive PEth. So you could have 1, 2, more ETGs, and it may not be enough alcohol to cause that positive PEth over 20. Okay. Brad Fitzwater asks, low-level alcohol consumption exposure is not necessarily enough to turn PEth positive. And that's the general assumption, that low levels of alcohol exposure won't cause a positive PEth. But what I'm suggesting is that we don't have enough data to be sure of that in every case. What is the role of CDT? Can it be used to help confirm a borderline PEth? That's another good question. I don't think so, but I'm not sure. And then how many grams of ethanol at one sitting would be needed for a positive PEth versus a drink a day for 7 days? Well, it's said that binge drinking is more likely to cause a positive PEth because of the area under the curve of alcohol level being much higher. But I don't see good data to prove that anywhere that I've looked. But it seems in small studies, I guess it's been thought by labs. It's not published though. Where they had people drink 1 drink a day for a week and then had them drink 4 or 5 drinks in one sitting, and the levels were even higher from the binge than from the daily drinking. So probably binge drinking does result in a higher PEth. I'm not sure though. Any other questions? You can unmute and speak up if you like. John?
John Jackson. So what you're saying is you've got a low level positive PEth and you had no other evidence. You've talked to their worksite monitor, you've talked to their, you've therapists, you've done your own test yourself. And the answer is we don't know. And so you watch them closely. Most of the people have been, it will get worse and you'll pick it up maybe a little later. But the alternative is to lower the boom on these people and perhaps destroy careers. And, if this is the perfect test, it'll be the first one I'm aware of too.
Completely agree.
Absolutely.
Great point.
But a PEth of 250 is different than a PEth of 34.
Yeah. I think so. And where that cutoff is, we don't really know. Where is the cutoff that would be proof positive of drinking? It's a difficult thing to know. We had that trouble with ETG. Where is the cutoff that says it's drinking? And it's too complicated because you can have more than one source of extraneous exposure. So that adds up, and there's just too many variables.
Do you, in someone, and I know that people expand their substances of abuse, but someone who's had an alcohol use disorder, like you say, 2 years in, and they have this positive test, do you throw in breath alcohols into their mix and follow up?
I think that's a good idea. I mean, I think it depends on the setting, but when there's suspicion, but not proof, I think you monitor them more intensively. And that could be breath alcohols with one of the devices that, or intensify their urine testing,
Yeah.
or both,
Yeah.
so it kind of depends.
That's a great point you raise, Greg. Combining many methods, and of course, urine ETG also would be an additional method. However, phosphatidylethanol has the big advantage that it is not subject to many influences like in urine, where you can even substitute your urine. So blood usually is your own. So phosphatidylethanol in this respect is an interesting biomarker to determine. So, but as you said, if there is a suspicion of drinking, of course, add clinical evidence and add ethylglucuronide and so forth. And just let me add, and it's a kind of advertisement, we newly created a PET net. No, it's called PEth.org, where you can we will have a webinar in March, PEth.org, where you can also have additional influence, and many people from the United States are there, like Ricefield, Judy Hahn, and so forth. And we also have added, also he does not know, Greg Skipper to our advisory board. So
Thank you.
we would be happy to have you on our webinar in March. Well, these issues also will be addressed, and people from the Netherlands and all over the world. That's a nice point where we can further discuss these points. And let me also make some advertisement regarding guidelines. And for Germany, we just last year finished guidelines on alcohol use disorders, and there was a clear recommendation for phosphatidylethanol. And these guidelines are as 3-level. It means it is an evidence-based study, meta-analysis and all that included, and then a consensus, which has been done by about 70 societies. So in the end, phosphatidylethanol was the preferred biomarker for alcohol abuse for longer lasting ethanol intake. It will be published in a way also in an English speaking journal, but for the moment, that's the information I can give to you.
So Frieder, somebody put in the chat that PEth.org does not work. So maybe it's not up yet?
Oh yeah, up for many weeks now.
Okay, so check it and see.
I gave you the information, so maybe you can follow it. Maybe it's PETnet or
you gave me peth-net.org. But
yeah, so maybe that might be the right web. Yeah, that might be right.
So I'll find out.
Changed it over the time. Yeah, you can forward it to everyone who is interested. Yeah, of course.
Yeah. So anybody else have questions before we close this? We have 5 minutes left, and we have 54 people in our group today.
On here
yeah, go ahead.
PEth test or blood spot test, is one better than the other?
Yeah, that's a really good question. The other question is about hematocrit. Okay, but let me answer the blood spot test first. So there's an increase. My colleague at First Source, Jim Ferguson, and I have been concerned about the blood spots because there do seem to be a higher rate of claimed false positives. Now, the issue there has to do with probably fermentation. So, when you take a blood sample, put it on paper, there's sugar in the urine and the blood, and if yeast settles on there from the air, if it doesn't dry right away, because you're putting it in a plastic bag and mailing it, there could be production of ethanol and formation of PEth in vitro. It's a long shot, but it's possible. And so there is a little concern about it. The other possibility was, could hand gel and stuff, like if you're using ethanol-based hand gel, could it be permeated into your skin? And when you stick the finger, could you be getting a little ethanol from exterior, not inside the body? And that's thought to not be likely. USDTL did a study on that, and they didn't think that was likely. But again, we're dealing with some unknowns here. There's not great data. And that's why I wanted to do this webinar, is we're assuming absolutes here and we don't have great data. Any other questions or follow-up?
Yes, I just have one more, Greg. For those that are monitoring folks with SoberLink, how do you supplement that monitoring? What do you choose as your test?
So you're saying they're on SoberLink already.
Mhm.
Well, you can cheat anything, okay? Like SoberLink, you can cheat SoberLink by getting a second breathalyzer, drinking at night after your evening SoberLink, and then not blowing in the SoberLink again the next morning until your other breathalyzer is negative, for example. That's the most common way I've seen people cheat. So that's important to set up windows to kind of minimize that risk. But, you know, adding urine ETG, adding blood PEth would be to, you know, random urine ETGs or occasional blood PEth might be a supplement to SoberLink.
Greg, is anybody really using hair? We have never used hair for ETG.
I don't know enough about it. I've looked at the research. I can't tell what the sensitivity is. You know, it's not very sensitive though, because we've seen a lot of people with negative hair ETG, and we know they were drinking because they've admitted it.
Yeah,
you know,
that's definitely true, Greg. And of course, there are many reasons. And I think we published in 2015 a paper in ACER, the Alcohol Clinical Experimental Research, like swimming in chlorine water, in would reduce ethyl glucuronide in hair, but if there is a positive result, it is very likely to be positive. And of course, hair covers a different time period. ETG covers a very small time period, phosphatidylethanol a longer one, and ETG is a kind of cumulative indicator of 2 to 3 months.
Okay. Any other comments or questions? 1 minute. Well, I want to thank everybody for participating. It's a great topic, and I'm sure glad that we had you all here. So we're going to do another webinar in March. If you have ideas on subjects, send them to me, and we'll try to make it interesting. Thanks very much.
Thanks, Greg.
Thank you.
Thank you.
Thank you.
You're welcome.
Bye, thank you.
Thanks,
Bye-bye.
Greg.
Thanks, Frieda, for joining us.
Yeah.